Hey everyone, thank you for being here. My name is Naveen, the host of Sounds On and Off. We are a podcast that is dedicated towards showcasing different perspectives around deaf culture, hearing health, decision making, and many more. In each episode, we will bring on various guests that will share their unique stories and the path that they're on today in hopes that you will learn from their experiences about the topic of hearing. We hope you enjoy the show.
Hey everyone, thank you so much for joining us on the podcast today. We're so excited to be talking to you. Today we have Silvia and Leslie, who I'll let introduce themselves. Silvia, can we start with you?
Yes. So hello, everybody. Thank you so much for having us. So as you say, my name is Silvia Belfort Salinas. I'm a licensed clinical social worker, and I work at UCSF Beniaf Children's Hospital, supporting the pediatric deaf and hard of hearing population.
Hi, my name is Leslie Manjarres. I am a teacher of the deaf. I am a credentialed teacher of the deaf who's worked in a variety of settings, school-based, early intervention in the home settings, and I've also worked outside of that in wilderness camps and also privately. And I work for UCSF part-time now, supporting the Hearing and Communication Clinic.
Wow, I'm so excited for the episode today because there's so much to learn from both of you. Sylvia, I'm going to kick it back to you again. Could you tell us a little bit more about what your role entails? What do you do in your job?
Oh, that's a really good question. For the children that visit our clinic, I'm going to say that my job starts, meeting patients and their families in our clinic. It's a multidisciplinary model. So we see patients with the audiologist, the speech pathologist, the MD, the health educator, which is Leslie, teacher of the deaf. And so from that point, I assess these children and their families to understand what their potential needs may be. So case management is one of the things that I do. And what that means is making sure that our families get connected either with the community, making sure that they are being supported by their school systems. That type of work. We also provide outreach, educational programs, to support our parents and our children. That would be what we call the educational piece. I do as a licensed clinical social worker. I provide emotional support, not necessarily therapy, but really counseling our children and helping, with adherence to treatment, basically. So that's kind of like the day to day. I mean, I do a lot of other things, but I would say that would be the core of my practice.
Thank you for sharing that. Leslie, what do you like to tell us about yourself, how you became a teacher of the deaf and, what that entails?
Yeah, of course. So I had kind of an unconventional path to becoming a teacher of the deaf. I myself am hearing, and I grew up in a small town where we had just a few schools, and I grew up where the schools had kind of this rotation system of where we had different grade levels. At one point, in third and fourth grade, my campus shared the campus with the special schools. And so all of those children were identified with what I now understand are IEPs and different disabilities. And I, as a good student, was offered to go volunteer my recesses to go hang out with them. And I was put into one of the classrooms for children with autism and cerebral palsy. But the classroom right next to them had children with hearing differences, most who were deaf, and they were just like me. They ran around, they communicated with each other in sign language, and I became friends with a few of them. And so they taught me some signs, and we hung out. And then I lost touch with them because there were two junior highs and two high schools where I grew up. So my junior high had the blind program, the other junior high had the deaf program, and then in high school they switched. So then my high school had the deaf program and the other high school had the blind program. And so I saw my friends again, which was very cool for me. And I had them in my classes with me with interpreters and all of those things. So I would hang out with my friends. And I took sign language class as part of my high school requirements, but it was always my dream to be a field research biologist and study insects. So I went to college for that, and that's what I graduated with. But in my senior year, after working at the camps that I had mentioned earlier, and still kind of hanging out with my friends, more people in the community, in the deaf community, they were saying, well, what do you want to do? And I realized that I didn't really want to spend the rest of my life in a lab by myself, that I really enjoyed being with people and community. And I looked into grad school, and so I went to grad school for teaching. And so I went to UCSD, and I got my credential to be a teacher of the deaf, and I got my master's in bilingual education for ASL English. And then I came to San Francisco and I taught. So that's kind of where I'm at.
Yeah, thank you for sharing with that a lot. Because for me, even I have cochlear implants on, and talking with people, while growing up, I also saw myself as normal because other people would treat me like I was normal. Like didn't really show any differences toward me. And to hear that, I feel like you're similar to my friends. So that actually helps the community a lot, and I want to thank you for that because that is one of the biggest things that I feel like would make someone comfortable and feel more appreciated and, fit into the community and or not, be shown any differences at all.
For sure. Yeah. No, I'm just, we're all existing together. So
yeah,
that was definitely something that my parents taught me, my mother especially.
Yeah.
That's so amazing. I think so many things to discuss from what you both have shared. And again, just so excited to be unpacking these with you today. Silvia, I have another follow-up question with you regarding something you mentioned, which is this multidisciplinary team, that's all working with this family to support this child and whatever, path they're on in their journey. And so I'm wondering if you could talk a little bit about ways you've helped families navigate the psychosocial aspects of a child's wishes, and how do you really center what the child wants in this kind of conversation?
Yeah, that's actually a very good question. And I want to say to Naveen, one of the things that I always remind parents is that, the word normal. What is normal really? And so it's very important that we understand that there is nothing abnormal about our children with hearing differences. So that's one of the things that I always try to remind parents when they feel, overwhelmed by the diagnosis, right? And so, in working with the multidisciplinary team that we have, I gather information from my colleagues, from the audiologists, from the speech pathologists. And part of my work in terms of counseling has a lot to do with normalizing the situation, right? And really helping children, parents understand, well, number one, the sky is the limit. And so we are also so focused on today that I help them see tomorrow, right? So what do you want for your child, when your child is older? where do you see yourself with your child when your child is older, right? Because that helps them, especially parents more than the kids. That helps really not be so focused with a diagnosis, but more so with support. How do I support my kid? And how do I make sure my kid doesn't feel different because of the hearing differences, right? Even when they are deaf, it's very important that we support and nurture that. So that's one of the ways in which I support my team. But I do different things also. I help families, make sure that they understand, like, for example, like Naveen, if they want to have a cochlear implantation, I make sure that they are getting the information that they need before making decisions. As a parent, I understand that a little cut hurt us twice as much. So I want to make sure that parents are reassured that they understand, the choices they're making. But another thing that is very important is that not all of our children, every child is different. And not all of our children are in early intervention or in, elementary school. So I also try to empower our older children to have a voice in the conversation. Having a conversation where, parents and doctors and social workers are all making these decisions, I think is very important to understand where the patient is at. What do you understand this to be? What do you want even? There are kids who, don't want to have a cochlear implantation and they want to be a part of the deaf community and they want to use ASL and that's who they are. And so I think that that's one of the very important pieces of my work. Does that answer your question in general? Because I can say a lot.
Yeah, I think that gives some more context to the role of, every member on the team and how it really takes a group of people who are thinking from different perspectives to really try to figure out the journey or the path this child and family want to embark on. And really, I'm hearing from you about meeting the family and the child where they are at that moment in time, but also sharing a little anticipatory guidance in terms of thinking what next steps might be so that we're thinking about that before it's a little too late.
Yes. And, one of the things that I've been doing all these years is also, making connections in our community. I have, established a lot of bridges with the school districts, with San Francisco General, pediatricians and all this community. For us, as I'm sure you noticed, making sure that our children are receiving the services that they need through the school system is very important. And so working with these providers has also been a very important piece for me, specifically in learning what that means, in learning what the training of these providers is. How do we partner with them? How do I partner my, speech pathologist at UCSF with the speech pathologist from the school district to make sure that the goals that are being designed to support these children are in sync. And so, so there is a lot of cooperation, a lot of partnering in assuring that our children are, building the skills that they need to move forward through, the school system, because that's a very big part of it.
Yeah, thank you for sharing that, Sylvia. Like for me, growing up, I always feel like, even having a social worker, we didn't really experience that. I think that probably came a little bit later on when, I was born and had gotten my implants, because like the only support that we actually had back then was the audiologists themselves and our parents or families. So for me, luckily enough, I had a great family support and they all supported me through this journey. But, knowing that you like somebody like you in your position, so I can make it. I'm pretty sure it makes it a lot easier for families nowadays to be able to, have guidance and, go through that process. And yeah, I want to thank you for that. And for thinking about this this concept of normalizing a child, or the family experience once a child is identified with a hearing difference. Can you speak about a little bit more about the stigma and how it can show up, especially thinking about families from diverse backgrounds?
Yes. Oh, absolutely. So I'm going to start by the premise that everything starts at home, regardless of culture. And so if you are the kind of parent who is constantly projecting a negative perception of hearing loss, and you don't think that your child is normal, or all this negativity, by default and even common sense, your child will believe that having any kind of hearing differences is something negative. And that has tremendous impact on a child's sense of self. And so, when we talk about stigma, there is also a history attached to hearing loss, and how, historically, people with hearing loss were perceived as having some delay, but they couldn't hear. So it's not that they had any kind of delays. The moment that you open, access to noise, to sound, or for deaf people, once they start finding the tools that they need to move forward, there is this sense of normalization, right? So the stigma is something that I take very personally, even though I don't have any hearing differences or any children with them. I take it personally because I don't believe in stigmas, and so if we don't tackle, the way that we talk about hearing loss, the way that we approach our children, the way that we approach devices, then we have to work on other areas, and those areas can be impacted differently. And again, this has nothing to do with culture. This has to do with human behavior, right? So, you hear about children at schools that get, stigmatized, and then, you hear about, behavioral problems, or, academic problems, or this or that. And, usually I just go to the very basics. Well, let's see where this child is at in terms of, do they like wearing their hearing aids? Can they really keep it together at school? Do they feel comfortable? So you have these children who actually cry if you remove them because they really want that access to sound. And then you have the other kids who struggle tremendously because they don't want to be perceived as different. And so that's where, a big part of the work really is in helping, the community as a whole understand that, wearing hearing aids is as neat as having cool glasses, because you can have them in different colors, in different sizes, in different, styles. And so that's where I'm coming from with that, helping parents know that there's really, if the only medical need that your child has is having hearing differences, then, there are many ways to support our kids and help them understand that they are no different than any other, that they're no different than the average child, if you want to look at it that way. Does that answer your question, Naveen?
Yes, it does. Thank you so much.
Yeah, thank you. Thank you for sharing that, Silvia. And I'm hearing that, it really starts with really how do we, expose this child to this journey that they're on, and how do you paint these, how do you, bring them to awareness of what is even happening, and how do you color it to let them then experience it through their own lens, and really portraying it in a positive or even neutral way rather than any kind of negative way, to really help the child come to their own conclusions about the situation. Leslie, I'd love to hear your thoughts on this if you would be comfortable sharing.
Yeah, I mean, I think a lot of this comes exactly to where Sylvia's talking about, that there is just this societal stigma about what hearing differences mean. And it's really more about that access that the child has, right? It's about access to resources, access to language modalities. It's about what what does that mean for the child to succeed as a whole? Because these are all tools that you give the child for them to succeed, for the long term. Right? It's not something that is necessarily going to be fixed and go away. And I think that that's a lot of what happens, from a clinical lens, is that often there is that stigma where, well, we're going to fix it. We're going to have the diagnosis, and then we're going to have treatment, and then it's going to be fixed, and then it's going to go away. As opposed to something with this, where hearing differences don't, get a diagnosis and then get treatment and then go away, where it's, a journey. It's something that impacts, all aspects of life, but at the same time, there are resources to adapt and do all of these things that you still can access and be a successful person if that is your path. If you want to do certain things, there is a path for that. If you want to do certain other things, there is a path for that. There's nothing holding anybody back except these stigmas about what those tools are, especially when it comes to wearing the devices and also using things like sign language as a modality, or using cue speech as a modality, or, being in those environments, right? There's a lot of pressures culturally, clinically, societally about what that means and what that looks like for the child.
Yes, you're so right about that, Leslie. And to what you said before, Naveen, it's not that culture doesn't have an impact. Culture, depending on, where the family is originally from, to understand, what their beliefs are about having any kind of difference. It doesn't have to be necessarily just hearing loss. Is super important, because, what we are trying to do, everything that Leslie said, is so important to the to the growth of that child. But at the same time, if you are working with a family whose culture, perceives this difference as something that they don't even want to talk about, then, the respect that we show that culture and that family is huge into that path to building trust, so that we eventually can have, some type of cultural influence as to why it would be important to address, the hearing loss. But that is, what we want to meet the child where the child is at. When we're dealing with cultures, we must understand where the family is at culturally, so that we don't disrespect those beliefs, if that makes, sense.
I don't know if that makes sense, because for me, my family, they came from India. So my grandparents, when we had moved here, they weren't really against or, supportive of the implants. They're just indifferent about it. Because, in India, when you're either, you have some differences, because it's a, developing country, there's not a lot of, educational facts, or, just education behind it, or, information behind it. So, my grandparents were like, oh, maybe he's a slow learner. Maybe he'll be able to, pick up on speaking later on, because I didn't speak for like, a good 2.5 years in my life. But, they didn't really, decline it, like, me getting implants. They just supported my mom. And my mom, they trusted my mom that, this was the best option for me to go to the audiologist and get implants. And, it worked out. But, like Leslie said, if even if you have implants or don't, you can still be a successful person. So, that's what the whole point of the podcast is, that we want to be able to, say that, either whichever path you take, you'll still be successful, and I'm sure you can still do great things. Just going on to the next question, speaking of access and options for families and kids, Wesley, can you talk about more about the spectrum of options with regard to education and misconceptions around what might be the best option?
Yeah, for sure. I think one of the things that we always talk about is that, for a free and appropriate education, which is FAPE. So they talk about what that looks like for public schools, right? That, children have the right to these services, children have the right to access these services through their local schools. And a lot of, work was put in, a lot of, activism work was put into ensuring that people and children with disabilities would have access to the same resources that their general education or their typically developing peers would have, right? So there was so much work put into that aspect of education. And at the same time, when we look at children who have hearing differences, it's not the same as your typical special education child, right? Because a lot of the times they don't have the same challenges as children who have multiple complex needs, right? They don't typically have cognitive delays. They don't typically have syndromic issues where they need constant, care or intervention. Typically what they have is the access or the lack of access to language. And so what they need is very different and very specific and very niche to the hearing difference population, to the deaf and hard of hearing population. And so what this looks like can be very different, and a lot of people don't quite understand what that is. And a lot of the times what happens is, in general, there are these kind of 5 placements or categories, right, that we place children in, which includes, general education, which is where everybody else goes, typically developing children. General education with some supports, which can be like a paraprofessional, a support person, a self-contained classroom, which is children of similar diagnoses or similar eligibilities are all together, a special education school, which is like a school for the deaf, or home education, which is like for medically fragile children, right? And so on this spectrum, what happens is, mostly for children who are typical special education children, they kind of stay on one track, kind of for their whole career. They might jump between one and another. But what happens for children who have hearing differences is that they might actually go across all of the options at any point in their life for a variety of reasons, right? They might start out in general education because they had really successful early intervention. They might have a mild bilateral diagnosis. They're doing really well with listening and spoken language, but it turns out that they have progressive hearing loss. And over the course of their life, it becomes progressively more difficult for them to access a general education classroom. So they might, over the course of their lifetime, over the course of the school lifetime, switch to one of the other options. Similarly, there's a child who might have started, at the school for the deaf. They might have lived close. That's exactly where they went for early education. They're using sign language, doing all these things. But then when they're in middle school or high school, they move out of that region and now they're in mainstream and they're using an interpreter, right? Because they have their language base, they have that access, and they're using that as their primary education mode. It's more about, where is that child going to succeed as an individual? And oftentimes these choices are put on this hierarchy, right? We often talk about how, there's the successful child who has been put in general education and wow, they're doing amazing. But what happens to that child, especially emotionally, and Silvia can speak to this more, when they're no longer quote unquote succeeding in that environment because of changes that have happened to them, either clinically or socially or situationally? What if they're no longer able to access that environment and things change for them? And that happens all the time for our deaf and hard of hearing children, because they might need more support or they might no longer need that support. And that happens all the time.
Yeah, thank you for sharing that. Because when I was in, I went to school to learn how to speak at oral school. So most of my classmates, they were all deaf and hard of hearing. And then I got mainstream when I was in first grade. And I've been in general education throughout high school. I mean, throughout, all the way through college as well. And I just want to talk a little bit about the IEP, how you were saying that the kids like us, of hard of hearing differences, a lot of people like, oh, do you really need this, extra time on the test and all of this, and I was like, I mean, I probably didn't need it, but, if it was there, I'm going to take the opportunity to use it. And, same thing in college, like note taking helped a lot, all the, accommodations that were there. I took advantage of them, and I want to just, just throw it out there that I encourage all the parents who have kids, with hearing differences, get those IEPs. They're there for a reason, to give people, have vouched for us to, get access to them, and we should use them. So yeah, thank you for talking about that.
Sure.
Silvia, would you have anything else to add from your experience in working with families, or do you want to speak to the emotional aspects of children, taking a detour, or jumping to a different course, like Leslie was saying, and how that might have impacted certain families that you've interacted with?
This is a topic that I'm very passionate about. And I can talk all day long, but we don't want to bore our, audience, right? But one thing that I think is important to address is, when we talk about our children who are either deaf or hard of hearing, as a social worker, I need to take a look at the whole family. And, we have families who, may be, monolingual, non-English speakers. We have families, who may not know how to access systems or find systems very complicated. The IEP, for example, is something, the IEP process is something that, for a lot of our families, they don't understand what that is. They don't know how to approach, someone in the school system. It can be very complicated, even for English-speaking families, to understand that the school system is not everything. You have, the regular school instruction, mainstream classrooms, but you also have the special education department and how those evaluations that a child must have, because, it's not, they cannot use what the doctors are doing, right? They need to have their own evaluations done by the providers in the school special education department. So there are so many details that entail, what a parent has to do, that even, for someone with the time and the language and, the means, can be overwhelming. Well, we need to take into account that we do have a lot of families who really do need a lot of hand-holding in that, if we want to make sure that the children are accessing those services, those resources, that, they need a lot of counseling and connecting. Otherwise, they don't know how to do it, and one thing that is difficult very easy for someone like me to talk because I work in a medical center with a team that provides a lot of support. For most parents who do not come to places like UCSF, they just go to see an ENT and an audiologist, they get results, and they walk away. That's all they have. So for a lot of families, even outside of California, I get a lot from providers like audiologists and speech pathologists where they're like, oh my goodness, your team is so lucky to have a social worker. But part of it is that a lot of people don't know what social workers do, right? And so social workers don't work with private institutions or private, medical teams. So there is this big area where the social workers actually play a very big role that is very much not talked about. And, that can be a separate podcast, to be honest, because we live in a multi-language community, if you will. And so I just want to add that to keep it into perspective, that the support that some of our children need goes a little bit further. And also, to keep into account that we do have also children, especially working at UCSF, where the hearing loss may be just one of the many medical needs that child needs. So when we talk about, for example, assessments for an IEP, in my case, I connect with many social workers at UCSF so that I can bring those social workers into, the conversation of, well, what does your doctor recommend and what does your doctor think should be added to these services? Because I can't speak for them. I don't know, for example, I couldn't speak for someone who goes to the pediatric brain center, for example. So I would like to just add that we need to keep into perspective that our children, every child is different, that we need to take a look at the whole family system. How do we support them and what are those needs?
Yeah, it sounds like, to bring it back to multidisciplinary, very holistic approach to really understanding the child and the family at that moment in time. And just like Leslie was mentioning, being comfortable with change and being comfortable with adjusting. And then something you brought up, Silvia, which is, having resources such as both of you, at our clinic, but also thinking about how do parents advocate for their child and how does the child then advocate for themselves as they grow older? Just like Naveen mentioned, how he really advocated for him using his IEP because he had access to that. And, I'm hearing a lot that it's all this stuff falls on the family. And I'm so glad that, that you both help the families, you work with, and that I hope somebody can hear this and, think about ways to advocate for themselves in an area where they may not have access to someone like both of you. Leslie, I'd love to go back to something you mentioned, which is the hierarchy and how there's, perceived differences. And I'm wondering if we can talk about a few misconceptions that exist out there. There's a couple I've already heard regarding, there's this concept of what's best for a child, or growing up in multilingual homes for someone who may use amplification devices. And I'd love to hear your thoughts on that and any other misconceptions that we should, put to rest today.
Yeah, definitely. I think there's a lot of misconceptions that we all bring to the table. I think there's a lot of bias that we as providers bring, whether it be educational, whether it be clinical. I think that that's something that we have to keep in mind. And for parents who are listening, I hope that they also think about that they know their child best, and that they ultimately make those decisions, right? That they're the ones who see their child day in and day out, that they understand their child, that they see, what these are, but also that they really need to understand all of these options and that there are options, because who is deciding what's best for this child? Who is talking to these parents about what is best for this child, and who is ultimately making those decisions? It should be the parent, and it should be the families, because if a parent feels pressured from a professional and saying this is what's best for your child, that is the point at which really the parent needs to take a step back and say, well, really, I'm the one who should know what's best for my child. What are all the options? Because there are always options. It is a misconception that there are no options. There are always options, especially in the world of, hearing differences and deaf and hard of hearing. There are always options, whether it be, clinical options, whether it be educational options, whether it be modality options. Like, there's always an option that you probably haven't heard about. Maybe there's a different resource. There are things that are out there that maybe haven't been tried yet. There are new and developing things all the time in all of these different avenues. And I think that that's very important. And I think it is a change that we need to continuously keep in mind, as people who are supporting this community, because we are supporting the community, to ensure that they're in the driver's seat, that families and ultimately people who have these hearing differences are in the driver's seat for these changes about what is best, right? And especially when it comes to, as you mentioned, families who come from multilingual backgrounds, right? Because a lot of times, as Silvia mentioned, taking that home culture into perspective, right? They're coming in with, generations and generations of ideas and philosophies and beliefs. And then they're coming into this whole other realm of systems and, other places that they don't have experience with. So a lot of the times what they're going to do is put their trust and faith into other people telling them what's best, especially in languages that they don't necessarily have full fluency in, right? I mean, a lot of our multilingual families don't have full fluency in English. A lot of the times we get interpreters who may not be the best fit for that particular family. We thank all our interpreters, any interpreters who are listening, but a lot of times they may not be the best fit for that family, and the message isn't quite getting there. And a lot of that kind of snowballs into how are we closing the gap into ensuring that the families and ultimately the deaf children themselves are understanding their needs and understanding that they have options, right? And that they can do whatever they'd like to do. But again, having these options, that these options are always on the table. If you've been oral for a long time, you can still learn sign language. If you've been, using sign language a lot of your life and you'd like to get implanted as an adult for whatever reason, that is an option that's on the table. Right? I mean, all of these things can be options, should be options.
Yeah, thank you for sharing that, because for me as well, I always question myself, what would it be if I were to be deaf? And, maybe if I were to grow up later on and learn about implants, I probably would have made the decision to get implants. But, my mom, in the beginning was the deciding factor for her to give me implants was that she wanted me to be able to communicate with my family, because we have such a large family, and she didn't really want me to be, the lone one out, because not everyone will be able to learn sign language. Made that, because, my cousins, they probably have to focus on their own, life and, learn other things. So it would be harder for me to communicate outside of my family with my, besides my, my parents and my brother, and, but to be able to communicate with my cousins, and et cetera, it would be a lot different. But yeah, like you were saying, whichever path you choose, I'm sure it will be the, it will be the right path for you, or it may not, but, you can always change it. There'll be different options on the table. And, we spoke with the parent earlier. He said that he was going to make the decision for his kid to get an implant now. And if the child later on in life decides to not have the implant anymore, he will fully support that. So, just to know that parents are, supportive of any path that the child will want to take later on, it's very reassuring. And, yeah, Sylvia, I wanted to say thank you. Being a social worker, it really helps. And I feel like you do impact a lot of families. And, if we didn't have you growing up, but right now I'm pretty sure, they're really thankful to have you. And Leslie, you being a teacher of the deaf and teaching kids, that's one of the best things you can do. And also making them feel more accepted and comfortable, and then just teaching them, life. I want to say thank you to the both of you. And, before we end today's session, I wanted for you both to be able to share one piece of advice that you would give to parents when they're first notified about their child sharing differences, if you can.
Well, the advice that I would give any parent is reach out for help. Every child is different. Every level of hearing loss is different. There are children who impact, the impact on language development in terms of spoken language may not be what the parent is expecting. And once again, in order to provide the child the best support, I really, really encourage all parents, reach out. For those parents who go to UCSF, they know that we are available to help them in any way that we can. But if you don't go to UCSF, there is still help out there for parents who need guidance. Grieving is a very real part of being a parent of a child with hearing differences. Is very real. Psychosocial situations are very real, but parents don't need to do this alone. There is, in the same way that there are options, there is help out there.
For my piece of advice, I have two sort of sayings that I share with all parents. So the first one that I share is that this journey is a marathon, not a sprint. And to ensure that you are ready and prepared for this marathon, not sprint, because a lot of parents, get really caught up in trying to just make it to kind of the next appointment, to the next thing, but it's a marathon. So kind of breathe and get yourself ready for that marathon. And the second one is no regrets. Whatever decision you make today, whatever decision you make tomorrow, you are allowed to change your mind in a year, in a month, in 5 years, in 10 years, because things change all the time. You're going to learn new information. You're going to meet new people. You're going to see different providers that are going to change your perspective. So no regrets.
Yeah, thank you both for sharing that. I even to this day, I still learn a lot of new things about, being a person of the, disability, like, hearing differences and all. But yeah, thank you guys for this podcast. I really appreciate you both coming on and sharing, your experiences and, what you do for work and all. I believe that the parent will appreciate it, and, the general people who will be listening to this.
Hope you enjoyed this episode. If you have any questions or would like to suggest a topic for us to cover on a future episode, please send us an email at silencepodcast21@gmail.com. Thanks again for tuning in, and we hope you'll join us for our next episode.